Travis?
Good evening. Travis Kruger, 739 Laureate Drive, Pewaukee. As a school board, we've talked about wanting teachers to install in all kids the skill of critical thinking. The definition of critical thinking is the objective analysis and evaluation of an issue in order to forge a judgment or opinion. I ask about critical thinking as you use the skill to make your decisions, especially on COVID protocols. However, in some recommendations that were made here tonight, critical thinking is completely lacking in that decision-making process. For example, when a quarantine protocol and a student or teacher has to get in that protocol, to determine them to return, they need to have a negative test or show they're fully vaccinated. Yet, we know from all the data, vaccinated people can spread the virus, right? I know the Waukesha Health Department has come out and said that's what their protocol is, so you guys are gonna follow what they're saying. That's lacking critical thinking, because once again, they're not using it either. Why punish an unvaccinated person when they can spread it, right? This is not something new. We all are aware of the science behind the Delta variant is being spread by both parties in terms of them getting it and then spreading it. And looking at doctors that come out and said, pediatricians or the CDC and other groups have said they want masking for all students. Would it matter if 1,000 doctors told you eating grass would prevent COVID? That's absurd. We would want the data. So once again, I want to see the randomized control study showing masks work. There hasn't been one, a true randomized control. There's been stuff on either side pointing to that and which they believe, but there hasn't been a random control study for a year and a half. And I believe there hasn't been because it would show very obviously they do not work. For example, the CDC did their own study on flu and masks. The title was Non-Pharmaceutical Measures for Pandemic Influenza in Non-Healthcare Settings, Personal Protective Environment Measures. It was published in May of 2020. The study looked at the influenza virus and the pandemics that influenza was a part of, but we all know that, well, you might not be aware of, the COVID particles are smaller than influenza. So critically thinking, looking at the flu was not stopped by masks, why would you think and have an outcome that COVID would be stopped when it is a smaller particle? And I can share this study with you. It's on the CDC's website. So rather than trusting a piece of cloth to protect you from COVID, I think there needs to be more of a greater emphasis on strengthening your immune system. God created us with an amazing immune system that can take care of us properly and protect us from millions of different viruses in the world. We need to focus on eating healthy, exercising, drinking water, taking vitamins, and getting the right amount of sleep. Doctors will tell you a major factor in COVID hospitalizations and death is directly tied to the obesity rate. I asked the school board to use critical thinking when determining the mandates for our children. Thank you, Travis.
Linda?
Linda Rice, 723 Alex Court, Pewaukee. I'm a parent of 2 kids in the district, and I'm here to express the opposite opinion. I am here in support of masks, especially for those children who are ineligible for vaccination yet. Unfortunately, things have changed significantly since 4th quarter of last year. The end of last year, I agree, things were calm, spread wasn't happening, it might have been okay. We're seeing Delta tear through classrooms and other settings, and unfortunately, it is a more contagious variant, and it seems to be having more significant effects in children. There are more children hospitalized now than ever before. Long COVID is also being identified in children with persistent neurological symptoms that are going to interfere with these kids' ability to learn in school. Unfortunately, when it comes to masking, the idea of parental choice is a fallacy. We know that masks work best when the person who has COVID is wearing one. It's most effective at preventing spread. Yes, the particles are small, but when a person exhales, those particles are inside water. So it's like a water balloon around that particle of virus, and we know that the mask prevents the aerosolization of all of those particles and keeps them closer to the infected person. It's less effective at filtering out the aerosolized particles that are already in the air. So if a parent chooses to send their child in a mask, it's less effective than if everyone is wearing masks, because it's not going to filter the particles from those kids who aren't wearing masks. One study of family transmission found a 74% reduction in spread if the infected individual was wearing a mask. There have not been randomized controlled trials. Why? It's unethical. You can't get a group of 100 people together, put masks on 50, not masks on the other, and expose them all to COVID. Nobody would sign up for that trial. We know that, I applaud you guys for offering the masked cohorts in younger grades. Unfortunately, that has broken down at the 6th grade level in particular. There's just too many different classes that the kids need to be in. My child is ineligible for a masking cohort because of his math placement. I'm concerned that 6th grade in particular is going to be an area of big spread because none of those kids are eligible. I just want to urge you to have a plan in place to re-implement masks quickly if spread happens. I'm concerned looking at what's happening around the country. I know that the American Academy of pediatricians who are devoted to caring for kids, they are recommending masking. It's not because of their own wanting to be popular or unpopular. It's truly what they believe is best for children. Children's hospitals are seeing more kids and are tired of having to treat kids. So I just want to let you know there are people who are still in support of masks and caution you not to overinterpret people who haven't signed up for the masked cohort, because some families were also concerned about singling their kids out by being asked to be placed in that cohort. Thank you.
Thank you, Linda.
Thank you for that. Looks like there's one more, Brian. No?
Carrie?
Hi, everybody. I'm Carrie Serbian, and I'm a parent of a soon-to-be 8th grader. And I'm here to speak in favor of masks being optional. There's a lot of reasons, echoing what people came up and talked about already. I think number one, I don't believe that the cloth or the non-surgical, non-N95 masks are even effective for the children. Just a lot of loss of the nonverbal cues that kids need. My son in particular is on an IEP plan, and he receives speech services, so I do not know how he would be able to receive those properly with wearing a mask. Just doesn't make sense. Also, some sensory issues going on where it's extremely uncomfortable to have him wear a mask all day. He has trouble concentrating, trouble breathing, headaches. We've seen other health issues happen. So I can't have him wear it this year. I will pull him out of school, and that'll be sad because he's been in school since 4K here, and we really love the district. But it's just not right for him. He is not learning the way that he should be, and I'll fill out whatever forms need to be filled out to get him to be where he does not have to wear a mask. We're beyond the point of it, and I think echoing what Charla said, none of you were wearing masks at any of the meetings, maybe the first one in June, and then now suddenly you're all wearing masks, which I don't get it. When everybody's in the grocery stores and all over doing that without masks, and that's what everyone's been doing this summer, except for a few people. So I just really hope that you'll consider the masks optional. Then I think it would have both sides taken into consideration instead of just one side. Also, I know there was a survey that went out to the younger children, it was mentioned before, to the parents of younger children rather, on who would want a mask-only classroom versus mask optional. And I don't have the exact percentages of that, but I think maybe you can clarify that. It sounds like maybe it was 20% of the population wanted masks mandatory in their classroom, whereas the 80% wanted it mask optional. So that's a question I guess I'd like to have clarified, because the majority is speaking here, and as our school board, I think you should listen to what the majority of parents of students in your district would like to have done. So thank you. Have a great time.
Thank you, Carrie.
Still got another one?
Hi, my name is Haley Melter. My address is N34W23193 Circle Ridge Road. I didn't plan on speaking today, so I'm just like a little flustered.
Take your time.
But I feel like if I didn't say anything, I wouldn't be sticking up for my son. I have 3 boys, but only 2 attend Pewaukee. 1 is too young, but I hope he attends Pewaukee too. So I have Miles Baldwin. He is going into 3rd grade, and last year when he had to wear a mask, he had a really hard time because he fell off his scooter and he scraped his face. And I don't know, I'm sure you guys have kids, and if you don't, but they are really self-conscious about how they look, and especially nowadays, because look is appearance is everything, and it's almost sad. But he was really, really what is the word? Self-conscious of his face because it had to heal. And I actually had to call him in a few days because his the mask was covering his nose, and I didn't feel I'm not a doctor, but I didn't think it was going to heal properly because it needed that fresh air. And if he's sitting in class for 8 hours with the mask on his face, that neosporin and stuff isn't gonna, heal properly. So I had to call him in a few days, and I had to tell the front desk lady, I was like, it's not because he's sick, he just literally has a scar, and I want it to heal properly. Sadly, it didn't heal. He still has this pink spot on his nose, which he's super self-conscious of, but I'm dragging on and on about his nose. And I guess I just wanted to say, I feel I don't even know what my point anymore was, but I feel it should just be mask optional for the parents to decide whether they want their kids to wear a mask or not. Because that week he fell down, I would have loved to send him to school without a mask. But I also think definitely should be a parent's choice, if they want, your kid to wear a mask or not to wear a mask. So, but I do care about the kids' health and safety, but I just think it should be our choice. So, thank you.
All right, we're going to go on to the next agenda item. We're going to turn it over to Superintendent about the mitigation plan.
Yeah, I'm going to go over here just so I can display the display the memo that's in your board packet, just so that the audience has a little bit of a reference of what we're talking about. It should be up in a minute here. I'll start talking. I think James is working on switching us over here to the laptop, I believe. So I'll get my tech support up here, but I'll just kind of start the conversation. So board members, in your packet, you have a bunch of information that was also, later today was put out in the public side of the board packet materials regarding recommendations. So I was just going to kind of walk you through the information in that memorandum. So first of all, why are we here having an updated conversation? The board acted in, here we go. Plugging it in does usually help. I've learned that through long experience. Thanks, James. But in terms of, back in July 14th, I believe it was, where we had the board meeting where you approved the plan. There was almost 0 cases in Waukesha County per day. Since that time, we've had an increase and are averaging, I think at the end of June, Waukesha County averaged about 2 cases per day. And as of now, it's about 125 cases of COVID per day. So things have changed in terms of infection. We've had lots of information from the county about Delta variant and increased transmissibility of that. So those are a couple of reasons why we felt it important to renew the conversation and talk about strategies. We've had new guidance that's been issued from a variety of agencies. We've heard from lots of parents who have concerns about the increase in infections and what we're doing about that. So we took a look at things, and as was already mentioned during some of the comment, we did issue a survey out to all families 4K through 6 to ask a second time, because conditions had changed, about interest in placing their child in a mask-required section, to voluntarily place in that, to try to find a creative way to address parent choice and concern for their child, as well as safety. And so we had roughly 200 additional requests for placement in a masked section. Carrie, you had asked the question, I don't have the exact percentage. I believe we had about 130 previously, so 330-ish out of about 1,400 students in those grade levels is what we have in terms of specific requests for being placed in those masked sections. Principals are currently working on creating additional sections for those students in response to those requests. So that's a little bit of the background and the context of why we're here talking about these pieces. It was certainly something we heard strong feedback on about board oversight with decision-making. That was something that was referenced in the plan that was approved in July, so it's appropriate that as a board you're considering the different recommendations. Included in the materials is a more comprehensive plan in all areas. That is aligned with the different areas of public health guidance. So between CDC and others, we've identified more than a dozen areas in which we have guidance and recommendations. And so the full plan that's linked into the memorandum as Table 1 shows you side by side the guidance and then what the current Pewaukee School District strategy. Those areas include learning environment, vaccination promotion, masking, contact tracing, isolation, quarantine, ventilation, COVID-19 testing, distancing and cohorting, symptom monitoring, cleaning and disinfection, hand washing and respiratory etiquette, and how we're managing visitors and volunteers in the system. So it's about and a couple more here, outdoor spaces and how we're using data and metrics. So it's a pretty comprehensive plan. It's about 10 pages in length with lots of information of the many things we're trying to do to create the safest environments that we can for students. Let me put this up here. I'm going to make it a little bit bigger. I'm sure it's hard to see in the audience. It's online. It's in the public-facing side of the board. Okay. Well, I can certainly get you a copy subsequent to the meeting. I can display it here for now so that you can see it. We'll certainly make sure that you have it. It should be available on the public side of board docs. It came out, but it wasn't until about 4 o'clock today that was up. So it depends maybe when you look. But we'll make sure you get it. Okay. All right. So the most notable modifications to the plan from where we were in July relate to areas of masking, contact tracing, quarantine testing, and the use of guiding metrics. So the recommendations that I presented to you for consideration seek authority for the administration to be able to implement described measures for 2-week periods of time. So we're trying to look at metrics in real time, be responsive, implement measures based on what the data tells us, and allow for that board oversight with kind of those 2-week windows of time to kind of review those actions. So looking to be flexible in our response to the changing conditions of virus transmission in the community. If things get better, we relax mitigation protocols. If things become more of an issue, we increase the use of mitigation protocols. That's the design of the recommendations that you have for your consideration. We'll go through the whole plan here for you to be able to see those pieces. Right now, we'll do the presentation. Board can have discussion, so it's not a citizen comment portion of the meeting. Masking. So the current status of masking is that the district recommends masking and the wearing of face masks for staff and students. Again, it's recommended. It's not required. When indoors, regardless of vaccination status, that's currently the public health guidance. In terms of our staff, they have been asked at this time to wear masks indoors when in the presence of students or when with colleagues if they cannot socially distance. I know, Carrie, you brought up speech and language. We talked about exceptions where it makes sense and having different approaches for students, perhaps students in special education and others, so that we can be flexible in terms of that. But again, that's a recommendation or something we're asking of our staff at this time. The recommendation related to masking seeks the authority based on the model, which I'll share, to require masking while allowing for a parent waiver or an opt-out if cases increase, as defined by that proposed model using that 7-day new positive case rate, which I'll get to after I get through these sections. Contact tracing and quarantine, the current status, which really kind of goes back to late spring, where all positive and probable again defined as close contacts who are symptomatic, that those individuals would fully complete 10-day quarantines. An exception exists for fully vaccinated or confirmed recently affected in the past 90 days who may return without completion of quarantine with the submission of a negative PCR test. That's what's currently in the public health guidance. Non-symptomatic close contact families would be, of course, informed of exposure, and the quarantine in those situations under the current status would be optional. We would be recommending that those non-symptomatic close contact students do submit a negative rapid antigen test, which is something we will be providing this year at school before returning, something that can be done in 15 minutes. And then we would seek a confirming negative test 3 to 5 days later to remain in school. Again, under the current level, that would be something we would recommend and not require. The additional recommendation in the plan for your consideration is to be granted authority to the administration, again, for those 2-week increments, if cases do rise, to require submission of negative tests for non-symptomatic close contact students to avoid quarantine or subsequently impose the CDC model. So in that case, if cases rise, as opposed to it to be optional to submit a negative test for a non-symptomatic close contact, it would be required, or the student's other option would be to complete the 10-day quarantine. Testing, again, which is new, and I think it provides us lots of opportunities this coming school year. We are bringing testing services on board. We're still in the process of that. This is a partnership with DHS, DPI, and NOAA Laboratories at no charge through our health rooms with our nurses to provide both rapid antigen tests and PCR testing for staff and students. Of course, no student would ever be tested without parent approval, and would be a process for that. We would recommend testing for any individual who is identified as a probable case or close contact, as I mentioned. We'd be recommending weekly screening and testing for non-vaccinated staff members as a preventative measure. And then the further recommendation, again, if cases of infection rise, that authority be granted to require testing, as described above, to support the contact tracing process I've already explained, depending on the rate of infection and defined in that model, which I'll get to in just a moment. That authority is granted to the administration to acquire once per week weekly screening testing for unvaccinated staff if rate of infections rise above the proposed, the rates in the model. So again, the guiding metrics, so the below model that I'll pull up here utilizes the 7-day new case rate for within the boundaries of the Pewaukee School District. This isn't specific to students. This is for all individuals in the community that live within the boundaries of the school district, which we would use to guide, again, the escalation or de-escalation of the mitigation protocols that are in the plan. This model was created by reviewing the daily rates within the district over the past 11-month period. The data only goes back to October 11th on the DHS site, so we went back to the first day and looked at every single day and tried to model out how these different levels would look if we overlaid them even with the current rate. So this table is a summary of just the monthly summary of the data, and again, we have it for each and every day, going all the way back to October 11th. You can see currently in August by this model, we would be in yellow in that second stage with a current rate of 4.328, or at least that's what it was on Friday when I put this together. You can see that in the months of February through July, we would be in that green area of the model, January, we were in orange, December in red, and November, which we can probably all remember as one of the toughest months, that November surge, we were in that darker red. October, we were in orange. So kind of the average over that 11-month span was 5.467. We had a high of 32.43 in November, and we were at 0 in the model just this summer back in June. So when we talk about, why are things maybe different than they were not long ago, the rates were definitely very different just a month or two ago. So this model really speaks to the masking, the quarantine, and the testing protocols. You can see this would recommend if we are less than 3.5 in terms of that average rate. And we would look at, 3 consecutive days as kind of our benchmark to say, all right, do we have any kind of an established trend? And if we're less than 3.5, we are really in that mask optional, where we're not recommending any kind of quarantine for non-symptomatic students who are close contacts. And that testing's available. There's really no recommendation or push to do additional testing, but that it's available. Yellow, the current, which should be greater than or equal to 3.5, gets to where we are now with that recommended use of masking indoors, staff being asked to wear in the presence of students and with each other when they can't socially distance. Positive and probable only would be put into contact tracing or for quarantine. Again, close contacts would again be encouraged then to submit to those testing. So just to kind of paint a picture, if John Smith is identified as a close contact and he's brought to the health room, he's not symptomatic, nurses would call home and recommend to parents that he complete testing to have a negative test before returning to class or returning to school, and then we would recommend a follow-up test in 3 to 5 days to ensure that he's negative. So the goal with the testing is if we're going to quarantine, let's try to do everything we can to make sure we're quarantining positive cases versus kids who may just be exposed but not necessarily positive. And then at that point, we would be encouraging the use of that testing as a weekly screener for non-vaccinated staff as well. So, and then as we go up to orange, we get above a 7.5. That's where we talk about a required masking with a waiver option to be in place, and more of a requirement for staff to wear masks. We would strengthen, again, contact tracing, where we would be requiring those negative tests to return to school. We would be requiring staff who aren't vaccinated to do the weekly screening as a preventative measure. And we would start to look at implementing for special events, say like a homecoming dance or something, screen testing as a strategy to try to run those kinds of events. And again, as we go up greater than 10, we are still at that required with waiver option for students in terms of masking. We continue to enhance the contact tracing at that level. Non-vaccinated students or who have not been recently positive in the last 90 days would follow the full CDC guidelines in terms of quarantine, where they would be required to quarantine minimally testing negative on day 6 or 7. They would be able to return early on day 8. Otherwise, it's a 10-day quarantine that's in place there. Again, weekly screening would continue for staff. We would require special event-based testing to run special events like dances or consider cancellation or postponement. And then when we get to a very high level, which gets closer to where we were last December, November, required masking, this would be one that would require additional board action to consider whether waivers would still be accepted, as we'd be at very high rates at that point. And again, the contact tracing and quarantine pieces are there that we've discussed. So that's the metric model in terms of mitigation that we suggest to try to help put some numbers to this and guide some of the decision making. This is data that we would publish publicly and maintain so that our community could be aware of what that status is, so that'd be part of our communication there. Then I have information here on learning environment, a change process. So we have mitigation, and then we have when we have to make decisions such as, do we need to move students temporarily to virtual learning? And is something that is very difficult to place a specific number on. So what I provided you with is the kinds of considerations that go into making a decision. And when we talk about temporary virtual learning, that might be for a classroom, that might be for a house, which is a cluster of classrooms at a grade level, that might be for an entire grade level or a school, looking at really a maximum of 2 weeks without further board action to change that kind of learning environment for students. And we really do have to look at that very much in context. So the kinds of data we would look at are student infections, positive and probable cases, students in quarantine, staff infections, staff in quarantine, substitute fill rates. These guiding questions that we look at, and here's why it's different. So I can have the same number of infections or kids in quarantine and it be a very different story. Is it contained? Is the outbreak because it was an athletic team or because there was a sleepover or a social event, and do we feel like we have it contained? Does it feel like it's very random and these cases are coming from everywhere? Is there a momentum in which the infections are seemingly to continue to increase and we don't feel like we have it under control? Are we able to staff those grade levels or those teams? Are too many teachers out? Are we right up against a break that might be in place where we just want to hold on for a day or so and make it work as best we can because there's a natural break coming in? So is it growing? Is it declining? And those kinds of things. So all of those things really have to be considered around with the numbers as we make a decision like we did last year as to whether we move specific groups into temporary virtual learning. So that kind of gives you the summary of what I laid out for you here tonight. And so with this board, I would take any questions from board members, and we can go from there.
Open up to board members.
I have a question.
Stacy?
Why would we ask teachers to wear a mask in a classroom that's not a masked classroom? If the families haven't requested it and they're fine sending their children, why would we ask the teachers to do that?
We would ask the teachers to do it when spread is as it is now, to take another variable, to reduce spread from one more individual in that environment. So right now, the guidance is that masking is recommended. So wearing those masks for staff reflect that recommendation. So, we would look for things to be in green to have our staff, it'd be purely optional. But in yellow, it makes sense with that being the recommendation that's recommended to wear masking that around students, that the adults in the system would model that by wearing masks. So that's the rationale.
But if we use the word recommended as their employer, we're basically telling them they have to do it, correct?
Well, we're not telling them it's a requirement. We are recommending it. So, yeah, that might be interpreted that way by some, but it's not a requirement. We're certainly not going to discipline or have negative consequences for someone if they don't.
Do you have a question, Larry?
No, I thought I turned it off. I have quite a few things I'd like to say, but I don't want to, if people have simple questions, I don't want to.
Questions or you have a statement?
I have both. Well, mostly it's a statement.
Okay, well,
Mostly I have a statement.
Can I ask one more question then?
Yes, absolutely.
The only other thing that I struggle with is and again, it deals with staff, is requiring non-vaxxed staff to test weekly.
That was my question too. I agree with that.
We know that vaccinated people can carry the virus, so I don't see why singling them out achieves anything.
Yeah, it's about trying to put layers of mitigation in place. You're absolutely right. As I know from experience, you can be vaccinated and get the infection. But what we are told from public health is that the infection rates are lower with vaccinated. The data, depending on where you look, varies, but the vast majority of new infections are with unvaccinated. So that's why the recommendation as a screening protocol, very convenient, right on site, where they can walk to their own health room. It's just another step because there is no mitigation step that is 100%. It's about putting a number of things in place to try to reduce spread as best we can. So that's the rationale for it, but I absolutely understand and respect the question.
So is there any reason that we can't have all staff vaccinated? I mean, if we get to this point that all staff would have a rapid test. So we're not singling out the the non.
Correct. We could certainly, if that's what this
If
group
we
wanted to
get
do,
to
we
that
could,
point.
require it for all, certainly.
If we're getting to that point.
Yes. We would have the capacity to do that in our partnership with the lab, so that's something that could be done.
Any question? Oh, Larry?
I just, Mike, could you just clarify back on the table in the chart, scroll up just a teeny bit, or so, no, the other direction, sorry. Oop, too far.
You want to go this way?
No, 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 no.
Do you want that chart, Larry?
The chart, yes, but go to the top of it where you have the guiding metrics. Right there. So when you say the boundaries of the Pewaukee School District, what does that mean, and how accurate is the data that you're presenting to us?
It is the physical boundaries of the school district. It's data that is accessible on the DHS Wisconsin website that you can filter specifically by school district. So, you know, so my presumption is that it's accurate as it's coming from the state agency specific to the boundaries of the school system. So that would be all individuals, cases among anybody who lives within those boundaries.
So it's reflective of the families, it's not reflective of the students.
Correct.
Or people who live in the school district boundaries, if you will. So, I mean, potentially one of the other things, I don't know how many of our teachers live within the school district boundaries per se, but that may be a reason because they live outside of our direct community potentially, so there's some value to that. And with the data, I mean, it's as accurate as we're gonna get in terms of reported positive cases, correct?
Correct, correct, yeah.
That's all, I'll wait till Steve has his opportunity here, so.
Anybody else? Steve?
Thank you. So I'd like to say, first of all, Mike, I'm really grateful that you've taken the time to work through this. I think the offer to parents to have mask mandatory classrooms wherever possible is a great offer. I think that honors the parents' wishes, and I appreciate that about the approach. I'm also very thankful that we have great data in the state of Wisconsin around case counts and outcomes. I think that's really helpful as we look at the data to try to distinguish what we ought to be doing. And I really like the fact that you've worked with other organizations to host those vaccination clinics. I think those are terrific activities to try to help students and parents and all community members who live in Pewaukee make the best of a really awful situation. And I'm going to use some of that data that is on the Wisconsin website to help me understand what's going on. And that's what I've been working on the last couple of weeks, trying to pull all that data together. So based on a population of 721,000 0 to 9-year-olds in the state of Wisconsin and just over 30,000 cases, the case rate throughout the duration since April 2020 is 4.2%. So 4.2% of the population of kids, if you counted them, 721,000 in the state, we've had that many positive COVID cases amongst that population. Hospitalizations are 407, or 1.3% of the positive test count. So 4.2% of the population has had COVID, and 1.3% of that 4.2% have been hospitalized as a result of that. I also found from the website, if you extrapolate that out, that means the effective rate of positive tests is 2.5 positive tests per month per 1,000 kids in that 0 to 9-year-old range, and 0.033 hospitalizations per month per 1,000 kids. So if you say that differently, for every group of 1,000 0 to 9-year-olds in the state of Wisconsin, we would expect there would be one child hospitalized every 30 months. That's what that data indicates. For 10 to 19-year-olds, there are 810,000 children in the state, 77,000 cases positive so far in the 17 months since they've been tracking the data. It's actually been a little longer, but really cases started to increase in April of 2020. So I started my data count there. 77,000 cases for a rate of 9.6%, 819 hospitalizations, or 0.059 hospitalizations per 1,000 children per month for every 1,000 10 to 19-year-olds in the state. That would mean there was one hospitalization every 17 months. So this is all based on the data posted on the website. So I started to then look at what's Delta done. So that's the whole history from April 1st, 2020 through last Friday's data, which was the 19th, I believe, 20th. So since July, I picked July 1st as sort of the start point for Delta because that's when Delta first appeared in Wisconsin. So for 0 to 9-year-olds in that period of time from July 1st through August 20th, the case rate is about the same as it was in the history we've been experiencing for the entirety of the virus. For the 10 to 19-year-olds, so it's about 3 cases per month per 1,000. And for the 10 to 19-year-olds, the rate has been 3 per 1,000, or a decline of 50%. So for the 10 to 19-year-olds, it looks like the vaccine's working because we've cut the case rate in half from what the case rate was prior to the availability of the vaccine prior to July. So since Delta's arrived, since just this 6-week period of time, since Delta's arrived, for a population of 1,000 children who are in the 0 to 9 age range, we would expect 1 hospitalization every 34 months, and for the 10 to 19-year-olds, 1 every 29 months. Improvements of 13 and 71% in hospitalization rates. So hospitalization rates are improving, at least in the short term. We can't say long term what that means because we only have about 6.5 months worth of data, or 6.5 weeks worth of data since Delta variant has hit our shores. So I want to say something about that's the data. That's what the data says, right? That hospitalizations at the moment appear to be declining substantially for the older kids, and I suspect that has a lot to do with the availability of vaccination for those children. And that's all statewide data. So for masking, I just want to give some points of data here. The CDC has performed no controlled randomized studies on the effectiveness of cloth and paper masks on the spread of COVID-19 in adults nor children. Globally, in the 18 months since COVID's become a threat, no such study has been performed using cloth or paper masks. The only study globally was performed by a Dutch organization using surgical masks and only on adults, and their study failed to demonstrate the expected 50% improvement that the researchers did expect from that study. A couple other facts about masking. The European CDC does not recommend universal masking in school, and nor does the WHO. Finally, I'm just going to give you one statement. This was published in the New Yorker magazine 3 days ago, and if you know about the New Yorker magazine, it's certainly not a right-wing conspiracy group. This is what they said. At the end of May, the Centers for Disease Control and Prevention published a notable, yet mostly ignored, large-scale study of COVID transmission in American schools. A few major news outlets covered its release by briefly reiterating the study's summary that masking then unvaccinated teachers and improving ventilation with more fresh air were associated with a lower incidence of the virus in schools. These are common sense measures, and the fact that they seem to work is reassuring but not surprising. Other findings of equal importance in the study, however, were absent from the summary and not widely reported. These findings cast doubt on the impact of many of the most common mitigation measures in American schools. Distancing, hybrid models, classroom barriers, HEPA filters, and most notably, required student masking were each found to not have a statistically significant benefit. In other words, those measures could not be said to be effective. So, given all that I researched in my preparation for today, my summary is this. Our current experience, limited as it is with Delta variant and COVID case rates, is the same or lower now than it has been for the last 17 months, with lower severity in children. The vaccines appear to be working, and masking with cloth and paper masks hasn't proven to be an effective mitigation strategy in schools. Given all of that, I do not find it to be appropriate to mandate masking of non-COVID positive, probable, non-symptomatic, and vaccinated persons, including Pewaukee School District staff, nor children under 12. Because of the study that was done, however, I am open to adult district staff who are not vaccinated and asking them to wear masks because that was proven in studies to have had a positive impact on COVID proliferation in schools. So I'm open to that. But having a trigger to for mandatory masking but giving parents an opt-out option seems like the same as recommending as students wearing masks, and it seems to be a distinction without any difference to me.
Thank you, Steve.
So Steve, one of your comments was about hospitalizations, and that really isn't our target, it's keeping the schools open, right?
I get it, but you know, if we're really trying to keep kids healthy, we have to consider hospitalizations as one of the negative consequences of COVID, because we don't close the schools when lots of kids get sick and end up in the hospital because of food poisoning. We don't close the schools because there's a bad flu year, and unless we hit the flu epidemic rate and we close for 48 hours and wash everything down, right? We don't do that normally. We've taken that approach with COVID because of our fear about what would happen. And it is true that for certain populations, COVID is a very deadly and very difficult disease. But it's not that way for children. And I don't think we need to be reacting as strongly as some would advocate because of children's health in this particular case. And if you look at what Mike talked about with closing the schools, a lot of it has to do with staff availability as well. And if we have a high percentage of staff participation in vaccination, I believe we'll have a very low incidence of COVID this year, and I don't think that we'd have the same level of concern this year that we had last year when we didn't know what we didn't know.
Well, certainly keeping the schools open is the critical part, and we have closed schools because of influenza, like you pointed out,
Yeah.
Or abandoned certain class grades because of it
Yeah.
for a period of time.
Yep.
And yeah, the resource shortage would be the teachers. You know, we don't have that in excess, so that protection would have to be there. But your point about not showing that any of these functions work in and of themselves, distancing, ventilation, masks, stuff like that, in and of themselves they don't, but that's the point of layered protection, that they all, in some, create a better situation. So.
Yeah, I didn't make that assessment. That was the CDC made that assessment that those things could not be proven to have statistically significant benefits.
As individual things.
Or in combination. You can't, no, you're reading that wrong, Brian.
Okay.
It's not in combination with anything else either.
Okay.
So what, if one mask doesn't work, then two works because it's layered? That's a faulty thought process.
Excuse us, this is the board discussion.
And we're the citizens and the parents.
Yeah, we understand that.
Yep, so we got to speak before you presented your case. Now you've presented your case, and we as parents and as citizens should be allowed to make our comments on the case that you presented.
You have already made your comments made clear before the whole program started.
I've got comments on the case that was presented by Mike Katie.
Well, right now, it's board discussion.
this is a board
This is the
meeting.
board's meeting, not
I
the
mean,
meeting of.
we as parents are letting you know how we feel.
I understand that.
You
and
did.
That's what citizen comment is for. Mike,
You don't get to ask us for input before you tell us what you're going to present. Your meeting notes weren't available online before the meeting, you've already acknowledged that. So to tell us that we cannot speak on what you presented is not right.
Okay, do you guys want to continue your discussion?
Jeannie, do you have any questions for Mike?
No, but I do love Steve. Steve, you said that you don't think the vaccinated teachers would need to be tested. How are you going to find out if they're vaccinated or unvaccinated?
I didn't say that, actually. I'm okay with I'm okay with testing probable and positive teachers before the return, as the guidance suggests. I actually, as Mike laid down the different options, the contact tracing and quarantine guidelines, I have no concerns with his proposal, nor do I have any concerns with the proposal Mike made about testing. I'm not okay with the masking requirements.
But for the masking, how do you know if they're vaccinated or unvaccinated for being in the classroom?
How do you know if someone's vaccinated or not vaccinated? You ask them.
That's illegal.
No,
Well,
it's
that's
not.
you can
It is
ask them, but
not
they don't-
illegal. You are completely wrong about that. It is not illegal to
You may
ask.
ask them, but they do not have to answer you.
That is correct. You are correct. They do not have to answer you. But you can ask.
Steve, I guess what I'm looking for right now is your comments on how it affects the vote tonight, how it affects the recommendation that's in front of us tonight.
So my comments, if we were to be voting on the proposal offered, I would be voting no.
Okay, and it would strictly be because of the masking.
Because the requirement is for students to mask and to have this opt-out option. I don't think that that's appropriate, nor do I think it's appropriate to require staff to wear masks if they're vaccinated and are non-symptomatic and have not had close contact with
Isn't
someone.
that if the metrics change, though?
Yes.
And wouldn't we be meeting, I mean, I guess I look at this as it's a free-flowing thing.
Yes.
That we don't know where we're gonna be 2 weeks from now.
Totally agree.
So this could actually change.
As well, the observations I made about the status of the health outcomes of all of these students with the just 6 weeks of data that we have could all change. And
Right.
I'm willing to consider a change to all of my observations if things change. But as the data stands today, and as the research has indicated about the effectiveness of masks on students in schools, there is no indication that those help.
Okay.
And the data does not indicate that the current health situation it's actually, health outcomes for students is actually better now than it used to be.
Okay, and I understand that. I guess what I'm saying is, with the recommendation here tonight, when we start school on September 1st, the students have the option, basically, I mean, we'll have there will be masked classrooms for those that want it,
Correct.
and other people, the other kids, do not have to wear masks.
Correct. But we're gonna ask the staff to wear masks, even if they've been vaccinated and are non-symptomatic, have had no exposure,
Right.
which I think is inappropriate.
We're not mandating it, though.
But Ann, you're essentially mandating it. If the please let us speak, please. If the employer is telling you, we highly recommend you wear a mask, you're telling me that the staff person's gonna say, no, I don't want to, and not have repercussions, or the fear of repercussions? It's the same thing as mandating it with the staff.
So what specifically would you change today for this recommendation for us to vote on?
Yep, I would say that if you go back to Mike's proposal on page 4 of the PowerPoint document, I would say that his statement is recommended when indoors staff asked to wear in presence of students. I would strike that.
Strike the second half,
I would strike the whole thing.
the whole thing. Okay.
Yeah, I don't think we ought to be asking staff members vaccinated staff members, I would change it, I should say this differently. I would change it to say, when indoors, unvaccinated staff members asked to wear masks in the presence of students and when they cannot socially distance from colleagues. I would also change under the orange section, the requirement with a waiver option. I don't think that means anything. I don't know the value of doing that. If parents are gonna have the option to waiver out, what's the point? So I would leave the guidance as is, that masking is optional. If you wanna use the language recommended, I'm fine with that.
Okay, on that one, students or staff, which group are you talking about?
Yeah, Steve, you have to clarify on the yellow section too on that.
Okay.
Because the first sentence refers to students, Mike, recommended when indoors?
No.
No, you're referring to the
Just
whole
masking
population.
everything.
Right, that's just, because it had stated it previously, it's recommended indoors to be worn, right. And just there was an additional statement regarding staff about being
Oh, I
asked
see.
to wear.
Okay.
So
I got it.
recommended indoors for all, which is the current status, but then it added more specificity to the staff piece.
Okay, I understand.
I understand why that's a little hard to follow.
So my suggestion, and it's just my opinion, folks, I'm just one of the members of the board, I would say that in the orange section, we can still have the language of recommended indoors for students and for staff
In which color section? The
in
orange?
the orange,
Instead of required, you
instead of required. I would say recommended for vaccinated staff. I would say that putting a mask requirement at that point on unvaccinated staff would make total sense because we've seen from the data, the CDC study, that makes a difference.
Stacy, you have any other questions?
I do. I have first a comment, and I've said it before, but I'm a mom, so I'm used to repeating myself. This past year, our children carried a large burden for us adults. And I don't want to see that continue. This is not killing our children. This is not even making our children very sick. I do not want them carrying this burden anymore. I have a 79-year-old mom. She is vaccinated. I am fine with her living in the world and with her seeing her grandkids without a mask. She is vaccinated. We have done what we need to do. The children do not need to carry the burden of the grandmas and the grandpas and the moms and the dads in this community. The other point is a small one. The waiver, do we need to refer to the waiver except for in the very dark red section? The waiver exists. We know it exists, right? I mean, why do we have to refer to it?
We accepted waivers at the end of the year last year.
I know, but they're there. It's just,
Well, if it's recommended, you don't need a waiver because it's not a mandate.
right?
Right.
But I guess the waivers exist. I get if our numbers are really high and we're in a situation that when we're over the 14 or whatever, a waiver will not be accepted except for medical. I get that, but I don't think the waiver needs to be even referred to in the other sections. It's a semantics thing, but it exists. It's possible. Does that make sense?
Yeah, if, I'm just going with the line of conversation that it's then recommended in those other areas.
It's not a deal breaker for me.
Yeah. No, I think I'm following you.
Anything else, Stacy?
No.
Ann?
My biggest thing is that it's going to change. And,
Hopefully positively.
and one way or the other, and hopefully in a good way, that we won't be dealing with this. So I know that we're gonna revisit this every
2 weeks.
2 weeks,
I'm okay
basically.
with that.
And if something changes, we can convene quickly. And I guess I would wanna make sure we're all on board with that, with things changing. That's all I have right now.
Larry?
One, I want to applaud Mike for taking the time to go through and put this together in terms of trying to respond to some of Steve's information. Steve, I appreciate you going through and doing all the data analysis and looking at the rates that are there. The one thing which is, we wouldn't be here having these conversations had the COVID virus stayed the same as it was back in 2020. It's a different virus, so we're dealing with a different variation of it. So while your data shows the rates and all of those things, it's the numbers that are more current. So your more current data, and we're not necessarily in a state where we have some of these things occurring, but I think if you look at other places across the country with younger children, they're seeing rates of increase much higher. Some of them because they have already started their schools in other parts of, Florida, other parts of the country, Missouri, other places, they've already started school, so they've already brought kids back. So what they're seeing is a result of whatever variant it is, I don't want to necessarily use the Delta or Lambda, but it is not, it is absolutely positively not the same virus that we all started with in the, again, February, March, I guess, what, March 13th? Is that when we cut down the schools in 2020? So that was a point in time. Well, now we're here doing the same discussion, but it's a different COVID virus. Whatever variant it is, I don't know. I'm not expert enough to deal with that. So I think the thing is, that's why we're kind of caught in this, because we don't have all of the science. We don't know exactly what Delta or what variant of COVID is out there affecting the kids potentially in the Pewaukee School District. Do we know of all of the football players that contracted the COVID recently in Pewaukee, was it a Delta variant or not? We don't know that, right? We don't have that information in terms of front of us. So all I know is that we have breakouts, we have numbers that you're looking at that are within the Pewaukee community, where the people live, where the kids live, and all of the things that are out there. And again, we're gonna bring them back into large groups, and so whatever strategies we have that can help us, and there's the whole page of things that Mike had put together of different things that we can do and have done, whether it's the air handling and air conditioning or those aspects of it, the physical distancing and cohorting, and cleaning, disinfecting, hand washing, respiratory etiquette. There's a lot of things we can do and encourage to help slow the spread or slow it from other kids contracting the COVID virus, whatever the variant is that's out there. So, I mean, I think that we've got to continue to have, in my mind, the checklist of things that we can do. So if there's tweaks and modifications to what you're suggesting, Steve, I guess I don't know how we want to handle that or word that or.
I'll take it up in a minute.
Yeah, and we'll get that in terms of going forward with it. The other thing, and I appreciate the lady who spoke, I mean, I work in the healthcare sector. When we have opportunities to do random controlled trials, that was what happened when they did the original test of the COVID virus vaccines that were out there. People got the placebo, people got the real vaccine, and they looked at the rates of infection from those different individuals. So when you talk about whether masks were required or not required, it's like, oh yeah, well, if we know and we find out in the course of a study, in other words, if they found out when they were actually doing the vaccines, they reached a point where the vaccines were in that 90, 95% effective, there's no sense doing any more placebo testing because it would be unethical and immoral for us to not take that information into account and to just, let's go ahead and continue to not give somebody the vaccine because we want to see if they're actually going to contract the virus or if they're going to die from it or not. So I think that's one of the things when we bring up that kind of research, you got to understand that there's some morals and there's some ethics that are involved on the part of researchers that prevent those kinds of things from happening. So some of it, I'm basically discounting what you're saying about the masking and what's out there, because again, you wouldn't necessarily do a random controlled trial on some of that stuff just because it's not there, so.
The Dutch did.
Right, doesn't mean that's right though, but.
So some people thought it was worthwhile, and they didn't do anything but surgical masks, but they did. So some people judge Larry differently than you.
Right, other than in the professional world in terms of researchers that are out there. Again, if you have a cure, you know that you've cured, you've already determined that there's a certain percentage of effectiveness with the particular virus or vaccine, if you will, you're not going to continue it. You just stop it in a medication. That goes on all the time because that's the value of a random controlled style is to want to see and prove the effectiveness of it as quickly as you possibly can. So that's my concern with it.
To follow up on that, you know, a single study is never proved. People have to redo the studies to validate, so.
Right.
Yeah.
I mean, and again, whatever kind of peer review was done in terms of the research, because again, good research is always typically peer reviewed, and sometimes even repeated just to do that. And if it was only one study, okay, well, that's not necessarily good. So I don't know. I mean, I'm again appreciative of the information that we have been given, and I wish in my heart of hearts that we would not be having this conversation. I did not expect this to occur when we had these meetings in May and June relative to this COVID, whatever it is now. It's different, and so that's why we're here. We're dealing with a different type of COVID variant virus that is causing us problems within our own community, And I think, yes, it's something that we have to take some responsibility for. I work in a setting, again, in healthcare, where we're now at a point where we're gonna be mandating vaccinations for staff, and we all required to wear masks in terms of our day-to-day jobs. I don't think there's any healthcare system that I know of in the southeastern Wisconsin that isn't basically mandating vaccinations for staff, and we all wear masks all of the time. So, I mean, it's just the way we work, and
It's
it's
a
an
different
expectation.
environment than this. It's not a
Okay.
school. It's
I
not a school.
understand, but,
Yeah.
but it's still for the same thing, though. I wear a mask because I don't want to get the virus itself, but I also don't want to give it to anyone else. And I think that's the problem that we run into, is that we're only looking at it from a single point of view, rather than looking at the broader community in terms of how do we protect others, how do we protect staff, how do we protect other children in the classroom. We don't know what their likelihood of catching the virus is going to be, but, you know, we kind of do things for the good of all, you know?
Done? Because I was gonna go to
Yep.
Jeannie, see if she had any questions.
I don't have any questions, but the only concern I have about making masks really, really optional is that I have relatives that are in the health field also, and they work in the pediatric health field, and they said that the rates for kids are starting to skyrocket in their offices.
All right, thanks, Jeannie.
And once you send all of the kids back to school, you've already automatically lost your social distancing. There is no distancing in the classroom when you have a full classroom.
Going back to Stacy, is there like a motion you want to make about this, the opt-out waiver?
Oh,
This is.
We'd have
this
to
is the-
amend the agenda, ma'am.
Sorry, man.
We would have to
Larry,
amend the
Larry,
agenda.
Larry?
I didn't quote any figures, ma'am. I didn't quote any figures.
Excuse us, we need to get back to it.
Yes, let's go.
We need to call the gavel.
Larry,
Listen,
no,
you
this
can
is,
raise your voice all you want, you can talk down to us all you want, but it's not gonna work. Let us talk.
Stacy,
Listen, you guys wanna be on the news? You really want, like the lady said before, do you really want the school district to be on the news for an asinine decision that you all make today based on anecdotal, non-evidence, on stories and opinions? Mr. Dukes, I'd like to know what you do in the healthcare field that gives you the right
Don't-
to
don't engage,
disprove
Larry.
facts from the WHO, facts from other countries, facts from studies. What do you do in the healthcare profession?
let's get back to Stacy.
You don't wanna,
Stacy,
you don't, wait a second, you don't wanna answer me?
no, we're not,
I am gonna keep on talking. You don't wanna answer me?
I'm gonna say this right now, we're not gonna go back and forth, this is an open discussion with the school board. I understand everybody's frustrations here, let them do their job.
We're doing our jobs as parents.
I understand that, last thing I wanna be doing is escorting you guys out of here because we can't have a civil discussion.
You're right, we'll be all over the
Do
news.
me a favor, sit down, let them finish what they're saying.
I'd like to hear answers from them
I understand.
instead of arguments between them.
You understand where I'm coming from, the
I
last thing I
understand
wanna do
it,
is take
I
you out of
understand that, but do you understand where we are coming from?
Understand. I
We,
completely understand, they're having a discussion right now. It's a.
with us. It's an open meeting, it's not a closed discussion.
There's not a second citizen comment
have
on
that.
this agenda. But I will say, understand, I think you really made your point very well. Your point's been heard. It's just the matter of the way that this works is they're having a discussion among board members and considered a motion. You've made your point very well. I think you've made it, everybody's heard it. It's been very clear. We'd like to continue so that the board can have their discussion and decide if they want to make a motion. That's what we would like to be able to do. Absolutely, and that's what elections are for. That's what citizen comment is for. That's what email is for. So you're absolutely right. You're absolutely right, and I respect every single one of you and everything that you've had to say. We know this is very important. We know you feel strongly about it, 100%. That's been made very clear, and you've been very eloquent about doing that. So I'm just simply asking you to let the board continue their discussion. I think they're having a very rich discussion, a very candid discussion, and so I would request your patience and allow them to, understand that you have opinions on some things that were said, but these are the 6 people who have to ultimately make a decision. I just request that you let them continue with their work.
No, Brian, we don't need to change the wording about the waivers.
Okay. Steve, would you like to make a motion to amend
I
this?
would. I would like to amend the recommendation that's before the board for action tonight. Specifically, the section, the table, let's get the right reference here. Proposed model for guiding mitigation decisions. I would like to modify the section that says greater than or equal to 3.5 under the category of masking to make the statement there, masks recommended when indoors, staff, unvaccinated staff asked to wear masks in presence of students and when they cannot be socially distanced from colleagues. Under the section greater than or equal to 7.5, replace the column under masking with the same language just spoken to in the previous section, the yellow section of greater than or equal to 3.5.
So the exact same from the yellow section to
Yes,
this.
to the orange.
We will need a second for that.
Second.
All right.
Can I get a clarification there, Steve?
Yes, sir.
Okay. So I just want to make sure I'm capturing it right. So, 1 second. So what you're looking for, I believe, is it the red, or is it the yellow, the orange, and the red?
I would personally like to eliminate the first red section in its entirety and only move to the second red section.
Well, now we're changing your motion.
Yeah.
Okay, because it was already seconded, wasn't it?
Yes.
Sorry, I apologize, I should have spoken that before. I'll leave that to go.
As was Jeannie, or Ann brought up, we gotta look at this every 2 weeks anyway,
Correct.
so.
Yeah.
Correct, I'll leave it as it is.
Okay. Mike, any bit?
So, the amendment to the proposal is that masking is recommended indoors and that the only staff that are asked to wear in the presence of students are those who are unvaccinated. That's the change.
Correct,
And then that same language would be in the orange section.
correct.
Correct, so I struck that with kind of the
Okay.
understanding that the yellow drops down to the
Okay.
orange.
We have a motion and a second. Do you want to do this by roll call?
I think we should, Brian.
Okay. Jeannie?
Can you just go over that one more time?
Sure, my motion was, so if we're looking at the table,
Okay,
hopefully you have that on page 4 of the document, right?
yes,
So page 3 is the green part, we're not changing that in any way. Under page 4 in the yellow, so the language there would be masks are recommended when indoors for students and staff, unvaccinated staff
okay,
are asked to wear in the presence of students and when they cannot socially distance from colleagues. So
Okay.
just add the word unvaccinated in front of staff.
and then you're bringing that yellow down to the.
And then bring
orange.
that particular same section down into the orange.
Okay,
Yeah, before you answer there, that kind of brings up a question then. If somebody doesn't answer whether they're vaccinated or unvaccinated,
My belief is, Brian, this. If we trust these people to teach our children, we ought to have the trust in them to have the ethics to answer that question truthfully.
we're talking more than just,
Yeah, I would not,
Teachers.
just to clarify that, I would not anticipate this being
Yes.
something we're going around with the clipboard and checking. This would be on
Yes,
the system.
on their honor. And I would agree, we should extend that same privilege
staff.
and honor to
everybody.
all staff members.
Everybody's employed.
You looking for a second?
No,
It's
you-
already been seconded.
It's been seconded.
For that change. Okay, Jeannie?
yes,
Yes.
Steve?
Yes.
yes,
Yes.
And I vote no. So motion carries 5-1. Okay. So So now, with that change, I'll need a motion to accept this plan going forward.
Move to approve the revised COVID mitigation strategy for Pewaukee School District.
Second.
I don't know who got that one.
Give it to Larry.
Okay, all right.
Will we do anything with that waiver stuff, or just leave it?
No, I said to just leave
Okay.
it.
Okay.
So Stacy?
What, sorry?
Aye or
Oh,
nay?
voting, yes, sorry.
Okay, and?
Yes.
Yes. Chair votes yes.
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 All right, it's unanimously approved. Thank you.
Move to adjourn.
Need a second?
Second.
All in favor, signal by saying aye.
Aye.
We are adjourned. Thank you for coming tonight.
Thank you.